Hi everyone. In today's video, we are going to be discussing whether or not police should be the ones responding to mental health calls. Hi, and welcome back to the channel. My name is Lauren, and I make videos about what it's like to live with schizoaffective disorder or schizophrenia. If you want to see more videos about this, make sure to subscribe and hit the bell for notifications. Also, if you'd like to help support the creation of our educational videos, please check out the link to our Patreon page in the description below. Once you become a patron, not only are you supporting us, but you also gain access to our private Discord community. Through Discord, we offer various peer support text channels, as well as weekly peer support group meetings. If this interests you, make sure to check out our Patreon. Also, we'd like to give a huge thank you to all of our current patrons. You are making it possible to keep creating these videos. Thank you. Okay, so should police forces be responding to mental health calls? This is a topic that is being debated more and more with the emergence of social movements such as Black Lives Matter and the associated pushes to defund the police. Part of these pushes are calling for the removal of police from the front lines of mental health crises, or just for the reallocation of funds that are going towards police forces responding to mental health calls, going to mental health teams instead. Police throughout North America are responding to almost all 911 calls involving people living with a mental illness or having some form of mental health crisis. A 2016 report by the Canadian Mental Health Association made clear that due to factors such as overcrowding in psychiatric wards, long wait lists to receive psychiatric care, and a lack of community services, it is often police who are the first to respond when someone is in distress. This is a problem not only because it leads to the criminalization of mental illness, but also due to a lack of training, these calls often result in unhelpful confrontation, which serves to increase paranoia, creates greater fear and distrust in the system, and the too often worst case scenario of being killed by a police officer. A study by the Treatment Advocacy Center found that those in the United States with an untreated mental illness were 16 times more likely to be killed by police. Between 2015 and 2020 in the United States, more than 1,300 people with mental illness were fatally shot by police officers. More often than not, racism compounds these crisis interactions. The Police Executive Research Forum found that new recruits receive a median of 8 hours of crisis intervention training. This is in contrast to the nearly 60 hours they spend learning how to use guns. Why are people whose primary training is in how to use guns responding to calls for those experiencing a mental health crisis? Police members are trained to use intimidation to gain control of a situation quickly, to use a commanding voice and presence with weapons at their disposal. It is clear how this type of response to a mental health crisis can quickly turn tragic. I am lucky that my interactions with police have not been fatal, and this likely has a lot to do with my being a smaller, young, socioeconomically privileged, generally well-presenting white woman. All too often, we have seen more tragic outcomes for Indigenous peoples or people of color experiencing a mental health crisis and coming into contact with the police. Now that said, I have also been traumatized by my interactions with police when I have been in mental health crises. I have been handcuffed on several occasions, threatened, and the victim of physical force at the hands of police. There is this assumption or perception within society that those living with a mental illness are dangerous and out of control, which is perhaps why police are still being sent to respond to these crises. However, according to the American Psychiatric Association, most people with mental illness are not violent, not criminal, and not dangerous. People living with mental illness are actually even more likely to be the victims of crime. Unfortunately, though, when police intervenes, this stigmatized perception that people living with mental illness are dangerous criminals is perpetuated. The International Association of Chiefs of Police stated in June 2020, police are often the only ones left to call to situations where a social worker or mental health professional would have been more appropriate and safer for all involved. Although police agencies are working to train officers in crisis intervention or mental health first aid, this does not take the place of proper medical treatment. The root issue here is that we do not see mental health yet as what it truly is, a health issue. We would never send police to respond to someone in cardiac arrest, but for some reason, this is who we send to respond to someone in psychosis or someone who is suicidal. Law enforcement is not healthcare, mental or otherwise. In response to this issue, many police departments have started creating mobile mental health crisis teams that partner police with mental health workers. However, the main issue with these teams is that it is still police who are being used as first responders. In Toronto, the mobile crisis intervention teams are only called after police officers have assessed the situation. These teams only respond to about 20% of the Toronto Police's mental health calls, not to mention that the police member of the team is still uniformed and represents an authoritative presence in these situations too. The chief physician at CAMH, Toronto's primary mental health hospital, said, "If somebody needs emergency medical care, they're not met by police. They're met by health providers. I think it should be the same for mental health care." She went on to say that after interviewing people who had encounters with this mobile mental health crisis team, they often felt threatened by the presence of uniformed officers, which made it even more difficult to be honest about the problems they are experiencing. So what might a better alternative look like? A great case study would be the model that has been implemented in Eugene, Oregon for 30 years now. They have a mobile crisis intervention program that sends mental health care workers and nurses to respond to calls involving people who may be experiencing a mental health crisis. Police are only called in if the mental health team feels there is a threat to their safety or the safety of the public. If you're wondering if this is going to be a more expensive approach than having police respond to these crisis calls, the answer is a resounding no. Not only is this a more effective model for actually helping these people, but it also saves an estimated $8.5 million a year as they are taking on 17% of this community's police department call volume. The program's budget is $2.1 million annually, whereas the annual budget for the police department in comparison is a staggering $90 million. I think a big thing to understand in this debate is that we are expecting too much from police. It is very obvious that their training does not serve anyone in a mental health crisis. So it feels pretty obvious to send teams more qualified to respond to these types of calls. People with mental health illnesses need care, not criminalization. So I suppose the next question is, what do the police think about implementing this shift? In Canada, police have strongly pushed back at the idea of civilian mental health care teams being first responders. The Royal Canadian Mounted Police Commissioner has said that she is in favor of more spending on social services, but not if it means cutting the budget of police services. To me, this feels like a body that wields a lot of societal power who does not want to give up this power in the best interests of those involved. Serve and protect? Eliminating encounters between police forces and those experiencing mental health issues is a social justice issue that needs to happen now. Not only will this hopefully reduce fatalities in these instances, but will also ideally lead to the empowerment of individuals to receive the care they need and deserve for their own mental health. I shared a bit about my experiences dealing with police being the first responders to my mental health crises, but we would love to hear from you too. If you have any experiences you'd like to share or further insights into how this issue can be addressed, please let us know in the comments below. If you would like to see more videos from us, make sure to subscribe. And just a quick reminder about how you can support us in creating these videos through our Patreon page. Thanks so much for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.